we're much more likely to die from suicide than being killed in the line of duty.
Staff with Portland Fire tell us mental health is a growing concern for their team. Call volume is on the rise, and crews face increasing challenges with drug use and overdoses across the community. Katu's Megan Allison is live now outside Portland Fire's Station 13. Megan, the call volume is really getting to firefighters.
Yeah, right. That call volume alone is wearing crews out. Before, Portland Fire would sound the alarm when rigs began running close to 3,000 calls a year. Now, stations like this one may run closer to 5,000 calls a year, and that could have a long-term impact on the department. Staff with Portland Fire and Rescue tell us crews are getting up multiple times a night to respond to calls, often staying hours at the scene to handle challenges like frequent drug overdoses.
Morale, unfortunately, is not what it used to be. Our firefighters are tired, they're worn out. Sleep deprivation is a huge issue for us. They have linked sleep deprivation with carcinogen-type issues.
Tara Stein is a licensed social worker who took on the role of behavioral health coordinator with Portland Fire last year. Stein tells us the call volume is having an impact.
Firefighters tend to have higher rates of depression and anxiety and substance use and PTSD and suicidality, and just the amount of stress that they're experiencing. On the stress continuum, it can be very high.
During the current fentanyl crisis, the type of call is creating strain as well.
They go on calls daily where they don't know what to do with these calls. They don't know how to help these people. We don't have the resources, and it's not what our 911 system was built to handle.
Battalion Chief Ryan Johnson says his team continues to advocate for a higher budget to expand resources, but they're also seeing less interest in the job. Johnson tells us earlier in his career, 4,000 people would come in to test to join this department. Now, that number is closer to 400.
When I came to Portland, Portland was a destination city. People don't ever leave here. I've come to a point in my career with what's happening in the city where we're seeing people leave and go to other departments, slower departments, or leave the career altogether. And that was unheard of, 30 years ago.
The battalion chief says nationally, the suicide rate for firefighters is going up, impacting 100 to 200 firefighters a year. We're live in Northeast Portland. Megan Allison, K2 News.
Megan, thank you for that. If you or someone you know is struggling with mental health, there are lots of ways to find help. We have a list of resources posted on our website, katu.com. Just scroll over the news tab and click on Recover Northwest.